Hello, I am your host, Jack Braha, and welcome to the Medcast Plus show. On the show, I'll feature local community physicians who are experts in their respective fields and will share their experience and wisdom so as we as a community can achieve awareness of health-related issues. I invite you to get involved so we can all become educated and tightly connected and to make a difference. Today we'll be focusing on diabetes. Over 30 million Americans have diabetes. It is one of the most costliest and most common conditions in America. It is likely that one of us each knows someone with diabetes. It not only affects our blood sugar levels, but can have effects all over our body. Today, we are very, very happy to welcome Dr. Iraklii Buziashvili, an expert in the treatment of diabetes. He is an endocrinologist and practices locally here in Brooklyn. Welcome to the show, Dr. Buziashvili.
Hi, Jack. Thank you. Thanks for inviting me.
Before we carry on, is it okay that I call you Dr. Buzz?
Yeah, that's perfectly fine.
So, Dr. Buzz, tell me a little bit about yourself and how you became an endocrinologist here in Brooklyn. Where are you from?
So, I was born in Georgia, which is the Republic of Georgia. Many people confuse it with the state of Georgia here in the United States.
You're not from Atlanta, Georgia.
I'm not from Atlanta, Georgia. I was born in Republic of Georgia, and I grew up and probably spent more than 20 years in Russia. That's where I got my medical degree. And when I was 27 years old, I came to this country where I had to pass my boards in medicine. And then I did several years of training in first internal medicine and then endocrinology.
So you're a young, excited doctor. You arrive here in the United States of America. Where did you start your training?
I did my training in Mineola, New York, which is outskirts of New York City. And I did my both residency and fellowship in Winthrop Hospital. And I was very happy doing my training over there. Since then, I moved to New York City.
So you're out in Long Island, you're at Winthrop Hospital, a busy university hospital. You complete your internal medicine training. That took how many years?
The internal medicine was 3 years of training, followed by 2 years of fellowship in endocrinology.
So here you are, you've done college, you completed a PhD, you've gotten your medical degree, so you're now 100 years into your training. You come here to Brooklyn. Why Brooklyn?
Well, for two reasons. First of all, my relatives by that time lived here in Brooklyn. And second, a big Russian-speaking community in Brooklyn needed a Russian-speaking endocrinologist. And I got an offer from one of the hospitals in Brooklyn to work for the hospital.
And you mentioned about the need for an endocrinologist in the area. And we see this quite a bit. There is a high demand, not only here, but across America for endocrinologists. Why is that?
Well, probably because the most common problem that we deal with on a daily basis, which is diabetes, it's still on the rise, and there are a lot of people that don't know they have diabetes, and probably more people are at risk of diabetes, and they also don't know they are there.
So because of the rise of diabetes, so many people across this country have diabetes. There's a need for docs like you, who are endocrinologists, who are experts in treating diabetes, to help get folks under control, to get their blood sugars under control.
Pretty much, yes. The diabetes is probably still one of the most common reasons why people go to doctors, why people are admitted to the hospitals. And as you've mentioned before, it's probably one of the costliest medical problems that we have.
So, as an endocrinologist, explain to me exactly what you do, because I know, as a gastroenterologist myself, a little bit about endocrinology. I know that when I have a patient with a hormonal problem, I send them to someone like you. So tell me, what does an endocrinologist focus on in their practice, aside from diabetes?
Sure. So the endocrinology actually means a part of medicine that deals with hormonal problems. And the word itself, the endocrinology, means, if you translate it from Greek and Latin, it means secrete into, or secrete into the inner part of the body. And by that, we mean that endocrine glands or endocrine organs, they secrete their products or hormones directly into the bloodstream. as opposed to some of the exocrine glands that you probably deal more with, like exocrine part of the pancreas, or salivary glands, or any other glands that have ducts. Endocrine glands, they produce the hormones directly into the bloodstream.
So what you're saying is that endocrine, meaning inside, the hormones you deal with are inside the blood vessels. The hormones get secreted into the bloodstream and they float around the body. And in our field of gastroenterology, where I practice, we deal with exocrine, meaning outside. So there are certainly hormones that can be secreted into our mouth or into our gut where we digest our food. But endocrinologists like you focus on the hormones that are in the bloodstream. What are some of the most common disorders of the hormones that you are treating in your practice?
Probably the most common disease that we deal with is, again, diabetes. I would say about 25 to 30% of the patients come in with thyroid disease, which is the second most common endocrine problem, or group of problems, obviously. But besides diabetes and thyroid disease, we deal with many other hormonal diseases, which comprise probably 10 to 15% of the endocrine problems. And we deal with all different hormonal deficiencies or excesses. And I'll just mention the organs that we deal with. Most commonly, these are parathyroid glands, which deal with the calcium regulation. Very important gland of pituitary, which is located underneath our brain and produces multiple hormones that regulate other endocrine glands, including adrenal glands that are on top of the kidneys, as you know, and also testes in men and ovaries in women are also endocrine glands. So we deal with multiple hormonal diseases, but again, the two most common problems that we deal with are diabetes and whole group of thyroid diseases.
So of all of these diseases which we've discussed, we're here today to talk about diabetes. The folks watching today are very interested in diabetes because it is so common. Explain to us exactly what is diabetes.
Okay, so if you want to explain the diabetes simply, it's basically an elevated blood sugar, a blood sugar that exceeds the normal range. And it's actually not one disease, it's a group of diseases. Thereby, I mean that you can have elevated blood sugar because of different reasons. So diabetes is diseases, not one disease. But yes, they all result in high blood sugar.
So if I think I have diabetes, what are some of the signs that I might have that would raise my concern that I should go see my doctor to get checked for diabetes? What are the signs?
Unfortunately, most patients with diabetes, and now I'm talking about type 2 diabetes, which is much more common than type 1 diabetes, and I'm going to go into the details a little later. Most patients with type 2 diabetes, they don't have any warning signs when they're diagnosed. But if we speak about minority of patients that do have symptoms, I would probably mention an unexplained weight gain or weight loss, as well as increased thirst and increased urination. These are probably the most common symptoms, but again, unfortunately, they don't happen in the majority of the patients when they get diagnosed.
And these symptoms of weight loss or weight gain, going to the bathroom more frequently, drinking more often, they're quite common and they could be representative of other diseases as well. Is that correct?
Yes, definitely. You can, or someone can gain or lose weight because of many other reasons, but it's always good to ask yourself, maybe it's related to the blood sugar, maybe I can't explain this weight loss or this weight gain. And obviously I'm not talking about 1 or 2 pounds plus or minus, I'm talking about 5, 10, 15, or even 30 pounds more or less. So it's always important to be aware of this kind of symptoms.
So folks need to be aware of their bodies, checking their weights frequently, and if they notice any simple changes, going to the bathroom more, drinking more water, the weight is starting to fluctuate without changes in their diet to see their doctor and consider having a blood sugar test. Now, you mentioned there are a few types of diabetes. What's the main difference between what we know as type 1 or type 2 diabetes? Can you explain that a little bit?
Sure. So type 1 diabetes is caused by an absolute absence or deficiency of insulin. Insulin is the main hormone that's produced by the pancreas and that regulates the glucose levels. So people with type 1 diabetes, their pancreas simply does not produce any insulin. Type 2 diabetes, which is probably much more common, which is about 85 to 90% of all patients with diabetes. People with type 2 diabetes, they do produce insulin, especially in the beginning of the disease, but that insulin, for many reasons, or many different reasons, does not work. And they also end up with elevated blood sugar.
So if I were to put it simply, type 1 diabetics, there is no insulin. And in type 2, there's insulin, sometimes even too much, but it's not able to work. And that would be the main difference between a type 1 and a type 2 diabetics. Are they treated differently?
Yes, that's the main difference. You're absolutely right. And a lot of times, especially in the beginning of the disease, they are treated differently. People with type 1 diabetes, since they do not produce any insulin in their body, they require insulin treatment. People with type 2 diabetes, at least in the beginning of the disease, since their body makes insulin, they may use the medications that make that insulin work better. So they do not require insulin in the beginning of the disease.
So once a patient is diagnosed with either type 1 or type 2 diabetes, they're aware that their sugar is elevated, they're starting to get their treatment with you. What other effects of the diabetes on the body are you looking for? What other side effects can someone suffer from being a diabetic?
When a patient's blood sugar is significantly elevated, patients, first of all, complain about their symptoms, as that we mentioned, unexplained weight loss or weight gain, frequent urination, thirst. And we examine patients with diabetes, especially with significantly uncontrolled blood sugars. They may have all signs of infectious problems. That's probably the most common symptoms that they present with. The infectious problems can present mostly on the skin, but they may have and they may develop infections in any part of the body. And for example, people with uncontrolled blood sugar, they can acquire pneumonias, which is an infection in the lung, more common than other people without diabetes. They may have skin infections, they may have genital infections. And as we know, they may easily acquire infection on their feet, which is one of the targets of high blood sugar.
So with our patients who have an elevated blood sugar, they're at a higher risk of getting infections that healthy folks would be able to easily tolerate or even cure on their own. Folks with elevated sugars cannot do this. How does the sugar affect the immune system? How is the sugar impairing the patient's ability to heal an infection?
High blood sugar, it affects the cells that attack infections, which are called leukocytes, and lymphocytes or white blood cells in fighting the infection. So those cells are not capable of fighting the infection. In addition, glucose itself is a pretty good food, as we can call it, for microorganisms, for bacteria and fungi.
So as you mentioned, folks with diabetes and elevated blood sugar levels, they have a hard time fighting infection. The rest of us who are healthy, a bacteria comes to us, we get an infection, we're able to cure it. Why is it that the patient with diabetes can't fight the infection the same way?
Well, high blood sugar does affect our ability to fight infection in a direct way. The cells that fight infection, the white blood cells, they get affected by high blood sugar. In addition, elevated glucose or sugar in the blood is on its own a very good feeding material for microorganisms, for bacteria and fungi. That's why people with diabetes acquire infections very easily and have a hard time to fight it.
So what you're saying is that the bacteria, which is our enemy, comes and invades us, and the patient with diabetes or high sugar, our army inside of our body is impaired. It can't attack the enemy. And not only that, because of the high sugar, we're feeding the enemy too. So our soldiers can't attack the bacteria, and then the bacteria love to come here because the sugar's high. They have plenty to eat.
That's pretty much what happens in the body with high blood sugar.
So we talked about infection. What are some of the other long-term side effects of diabetes that folks need to look out for when they have an elevated sugar, when they're diagnosed with diabetes?
Sure. So in addition to these immediate symptoms of high blood sugar, patients with diabetes, they develop what we call late complications of diabetes. And this is what we try to prevent by normalizing their blood sugars. And as we all know, the targets for high blood sugar are several organs, pretty much every organ in the body, but most commonly, people have complications in their eyes, in their kidneys, in their blood vessels, in the heart, and in extremities. But pretty much there is no organ in the body that is not affected by diabetes in a long way.
So this is a full body disease. Someone with diabetes has to be concerned from the top of their head to the bottom of their feet, is what you're saying. Now, I have folks who have come to my office, and I've seen men and I've seen women. Some of the men describe problems with sexual dysfunction. Is that something that you see commonly with diabetes?
Oh, definitely. And diabetic neuropathy or nerve damage in high blood sugar is a very common and probably the most common late complication of diabetes. And it affects other organs because we get nerves going into every organ in our body. And you probably see a lot of patients that have diabetic gastroparesis when their stomach or intestines just do not work because of diabetic neuropathy. On the other hand, people with diabetes and men with diabetes get sexual dysfunction, and again, part of it is because of the diabetic neuropathy. And finally, patients with diabetic feet ulcers. The reason they get the ulcers is because of the low sensitivity in their legs, which is again caused by diabetic neuropathy or nerve damage in diabetes.
Right, so this diabetic neuropathy means an injury to the nerves, and we all know that our nerves go everywhere in our body. You know, if you step on a nail, you immediately feel it, but what you're saying is a diabetic patient may not feel that because of the sugar affecting the nerves. And that's very important, and you brought up an important topic. As a gastroenterologist myself, I see plenty of patients with diabetes who have trouble with their meals. They tell me when they eat, they feel full too quickly, they feel nauseous, and some of them vomit quite a bit. They throw up their food quite a bit, and the diagnosis is diabetic gastroparesis, as we as physicians call it, but for folks at home, gastroparesis means a paralysis of the stomach. The nerves that are going to the stomach are paralyzed. And so we have to treat that with you as the diabetic expert to get the sugar down. But there's also some important dietary changes that I recommend. What is it that you recommend for your diabetic patients to do with their diets?
So, yes, when a patient is diagnosed with diabetes, then obviously the patient asks me, okay, doctor, how are you going to treat my diabetes? What am I supposed to do? Are you going to give me medications? Are you going to give me insulin? Are you going to admit me to the hospital? But probably the most important treatment that the patient can do to him or herself is start what we call lifestyle modifications. And a diet is a pretty big part of the lifestyle modification in patients with diabetes.
This, to me, and you'll tell me your opinion, this is the hardest part for patients. It is very difficult to change years and years of habits, whether it's poor diet or lack of exercise. You know, to me, that's the hardest thing to help a patient with. How do you feel about that?
It's definitely not easy to change your many years habits but it's very important for anybody, and especially for a patient with diabetes, to be aware of their diet, their physical activity, and there are multiple specialists that can help them with this issue. For example, they can go to a dietitian, they can go to a diabetes educator, they can go to a personal trainer. There are people that help patients achieve their goals with lifestyle modifications.
And so when patients come to us and say, "Doctor, but I walk a lot." Now, walking is good, but this isn't the type of exercise you're talking about. What kind of cardiovascular, what kind of exercise do you feel is really beneficial for your patients with diabetes?
Well, exercise should be tolerable to each and every patient. And some patients can run a marathon. Others probably can walk around their block for 10 or 15 minutes. Anything will be beneficial. And I would say patients can go a little bit below their maximal tolerable level of exercise. If you're a swimmer or runner or you like jogging, that's what you can do. And some people just simply walking, that helps as well. I've had patients that were successful in lowering their blood sugar and lowering their weight by just walking for 30 or 40 minutes, not running or swimming.
So even simple activity may be of some benefit, because in gastroenterology, we have folks who have gotten rid of their reflux symptoms by simply losing weight. And I have seen folks, when I did primary care or in our practice of gastroenterology, who have gone to the gym, they've gotten on the treadmill or the elliptical machine, and they're really good at it, and they shrink their waist, they get rid of the fat, they lose 25, 30 pounds, and I've seen them stop taking their blood pressure pills. Have you seen folks reducing their need for diabetic medications?
Yes, definitely. I can give you many examples of dedicated patients being scared by the diagnosis of diabetes, which changed their diet, changed their physical activity, have lost significant amount of weight, and I'm talking tens of pounds, and I have patients that have lost 60 or 70 pounds just by lifestyle modifications, and they got rid of their diabetes. Even that can happen.
That's really inspiring, that folks can help their diabetes by simple diet changes, by exercise. But here we are, you have a patient with diabetes, we don't have enough time to get their weight down, we have to start using medicines. Now, I remember my grandpa back in the 1980s with diabetes, taking out a hypodermic needle, going to the refrigerator, pulling out a vial of insulin, shaking it up, warming it up, and drawing out some insulin, and multiple times throughout the day, injecting himself. And it just seemed so tedious. Is it easier today? What's out there today for treatment?
Yes, probably diabetes and medical treatment of diabetes is one of the fastest developing fields. So approximately every 4 to 6 months, we have a new medication for diabetes coming out to the market. And I'm very excited with each and every medication that comes out. We probably have around 25 or 30 different medications that we use for diabetes at this time. And it's not only insulin, obviously.
Are patients going to have to use needles, or can they use pills?
Yes. Again, patients with type 2 diabetes can use oral medications. And about 8 to 10 years ago, we started having injectable medications that are not insulin. And a lot of patients get confused when I tell them, okay, I think you should be taking an injection. They think it's insulin, which is a great drug on its own, but nowadays an injectable medication does not only mean insulin.
So there are multiple ways of treating this disease. I think the most important thing for our patients watching here today and our viewers is to look for those warning signs you mentioned, to see their doctor, because early diagnosis and early treatment can result in better outcomes.
Yes, definitely. Everyone should be aware of these symptoms. I would probably say that the most important thing that can predict your diabetes is your family history. If your parents had type 2 diabetes, you have a very high risk of developing it at some point in your life. And statistically, it's proven that if both parents had diabetes, you probably have between 80 and 100% risk of diabetes.
That is a tremendous, tremendous piece of information there. Thank you, Dr. Buzz. Thank you for educating our viewers and me today about diabetes, and I hope everyone takes your advice and looks out for the warning signs, sees their doctor, gets tested, because there is just incredible treatment out there, and once detected and treating early, we can prevent those horrible complications that you and I talked about today. Thank you for your interest in our show and desire to become involved and educated. I invite you to visit our website www.medcastplus.com, and check out our tools and connect with us on social media. If you would like to participate in the show, you can call us at 718-510-2103. Please stay safe, stay well, be healthy, and goodbye for now.